Hello again and welcome to this COVID-19 update for you and your community here on the Bass Coast, presented by Bass Coast Health and sponsored by Wonthaggi Miners Dispensary. In today's update, we take a look at one of the many specialised areas at Bass Coast Health, that of haematology, and what connection there may be to COVID-19. Two haematologists to meet. Firstly, Dr. George Grigoriadis and Abbey Willcox. Dr. Abbey Willcox. Firstly, Dr. Grigoriadis, hello and welcome.
Hi, how are you, Kevin?
Very good, thanks. So, George, as a haematologist, what patients do you see?
So as a haematologist, we see a large breadth of patients, both patients with blood cancers and also patients that have other blood problems. But in particular, my interest is patients with blood cancers who, depending on what they actually have, some do require treatment and others don't require treatment at all. And we observe these patients. But patients that require treatment obviously need to be monitored very closely, and by definition, they're obviously an at-risk population group for various infective processes.
And there's a lot more activity now at Bass Coast Health that involves a specialist like you.
Absolutely. In the last year and a half, we've established a haematology service. In addition to a haematology service, we have a number of other services that of medical specialties that I bulk bill to our patients, including oncology, cardiology, geriatrics, radiation oncology, and gynecology. And these services are free for our patients, and we basically ensure that they're able to get therapy and treatments and diagnosis at home or closer to home rather than having to travel to Melbourne.
Right, and you operate from Wonthaggi and Cowes, don't you?
That's correct. So we do operate both. Usually on a Thursday morning, we consult out of Wonthaggi, and then in the afternoon we go over to the hub in Cowes. Clearly, currently during the COVID-19 lockdown, we're consulting predominantly out of Wonthaggi via telehealth and via telephone. But still, there are a number of patients that need to come in to get various infusions or various therapies at Wonthaggi. So that's actually still an ongoing and active process that's actually being run currently every Thursday, and of course Monday and Tuesdays when I come down here.
Right. Let's get the connection between haematology and COVID-19.
Absolutely. So as many of you are aware, COVID-19 is a novel virus that basically has had a profound impact at a global level. And one of the concerns is obviously how it impacts our population. And clearly, we know that older patients are clearly susceptible to the effects of COVID-19. But furthermore, we do know, and there is emerging data, that patients with underlying immunosuppressive disorders and hematological or oncological malignancies, or that is cancers, are at increased risk, or patients that are basically given drugs which result in a decreased immune response. This is a group of patients that we actually collectively call immunosuppressed. And immunosuppression.
What does that mean?
So briefly, immunosuppression is a term that we use to basically mean that the immune system is actually reduced, and that can sometimes be as a result of a disorder. So some conditions that our patients actually have, for example, cancer in itself can result in immunosuppression. Yeah. Or some of the medications that we use to treat various therapies, whether it's malignancy, whether it's autoimmune diseases, for example, patients with rheumatoid arthritis, with lupus, with various kidney diseases, various skin conditions are given drugs which result in immunosuppression. And furthermore, there are some infectious diseases, conditions and various viruses that can result in our patients being immunosuppressed. So in general, that just means that they're more susceptible to various infections. And one thought is that basically these patients, or this group of patients, represent an at-risk population, and we need to be quite cognizant of that and careful that these patients are protected as far as we can.
Right. Let's talk about that protection with my next guest. Thanks for being with us, George.
Thank you very much.
And this is Dr. Abbey Willcox. She joins me now. Welcome, Abbey. Why exactly are people with cancer and other conditions more susceptible to getting infections and respiratory illnesses such as coronavirus?
It's a very good question, and I think that the underlying reason is often underpinned by a lot of different factors. Okay, patients' disease in itself could be compromising their capacity to mount a response to these infections. their lungs may be involved in that process. And additionally, the treatments that we give our patients for treatment of their underlying disease often does, compromise their capacity to mount a response to the infections that they come into contact with. That puts them at much higher risk of, quite serious complications if they were to come into contact with something like COVID-19, but lots of different infections that we have in the community as well.
And are you dealing with a great number of patients now that are in that bracket?
Look, we've certainly, at Bass Coast, we are building our population of patients in the cancer space. We've still got a relatively small population, and many of whom we're continuing to treat throughout the pandemic with their appropriate chemotherapy. It's always a fine balance between protecting them by using the treatment and controlling their disease well versus putting them at risk of other infections. We're treating increasing numbers of patients locally though, so I think that it is really important to consider.
I think it's also important to put it out there that it's safe to go to the hospital to be treated. There are many, many safe areas of Bass Coast Health where you will not come into any contact with any area dealing with COVID-19. Correct.
We've done a really good job of trying to separate the populations of patients who are not only at risk of, or needing ongoing therapy, but those that are presenting with concerns about, viral infections and the like, and making sure that those populations of people don't mix and that the staff treating them are well and are also, in line with our current sort of personal protective equipment and things like that, so that our patients are protected from us as much as us from them.
That's true. We've learned a lot over the last couple of weeks about PPE, its importance and how important it is to everybody, not only at Bass Coast Health but to the entire health service. So what can we all do to protect those in our community who are more vulnerable to infection? I think we can't stress enough the number of things we can do to help here.
Yeah, definitely. Everyone can play their role, and I think that the message has been really clear: stay at home, don't do the unnecessary things in your day-to-day life that can wait. That doesn't mean don't come to your appropriate appointments. It doesn't mean don't get petrol in your car, but be sensible about what you're doing and try and stay at home to protect these people as much as possible. We've got large populations of patients both here in Bass Coast but also in Melbourne who have to continue to attend the hospital to get the care that they need. Help us protect them by staying away from the places that you don't need to be so that they can get the care that they need and we're all safe.
Now, where are you based in Melbourne?
So predominantly at the Austin Hospital is where I work. Dr. Grigoriadis is predominantly Alfred and Monash. So we've got all of the main metropolitan hospitals covered.
That's great. It's wonderful to have yours and George's service here. Thank you for being with us today, Dr.
Not at all.
Willcox.
Thank you for having me.
Dr. Abbey Willcox and Dr. George Grigoriadis, our guests today. Thank you for sharing us on Facebook. We look forward to seeing you again soon. And until then, take care.